Welcome to the first session of the Pieces of Systematic Review with Margaret Foster. We've been calling this series Pieces 2.0, and we're so excited to have all of you join us today. Let me go ahead and introduce Margaret for those of you who are unfamiliar with her. She did a session for us just 2 years ago, and we're happy to have her back again. Margaret is the Associate Professor at Texas A&M University and serves as the Systematic Reviews and Research Coordinator at the Medical Sciences Library with a joint position at the School of Public Health. Her work with systematic reviews began more than a decade ago while completing her Master's of Public Health. In her current position, she provides consultations for researchers in medicine, public health, veterinary medicine, education, and other disciplines, and has published over 30 articles applying or describing systematic review methods and evidence-based practices. In addition, she is a co-founder of the Medical Library Association Systematic Review Special Interest Group and has developed a popular continuing education course about systematic reviews, which has trained over 1,000 librarians. We are so pleased to have her back with the SCR again to present this Pieces series to you. Good afternoon, Margaret.
Oh, I think, am I there?
Yes, you are.
Okay. I think you unmuted me and then I clicked it again. Sorry about that. So good afternoon to everyone. So today's session, as Sarah said, is going to be a little bit of Pieces 2.0. And I want to go over just a little bit about what the plan was for this so you can kind of see where the series is going. And just a little plug for me and Sarah's book here. This first session covers a lot of what we cover in the book on Chapter 3, which was actually the hardest chapter of the whole book to write because it's about this beginning step of planning the review and what do you do in those initial meetings. So today I'm going to try and talk you through how I think about those sessions. So in these sessions we are going to be talking about the steps overall and a little bit in general, but we're really going to do a lot of the nitty-gritty stuff and using 2 case studies, one that's a systematic review and one that's a scoping review. As I get a lot of questions about what's the difference, what do you do? And so each session will go through those case studies and I'll give you a little bit more in the pre-reading so you can kind of see some of the emails that I get. I'm trying to replicate some of the situations that happen throughout the process to make this as real as I can. And you'll see that the topics follow the process of doing the review. We made these sessions 90 minutes long so that hopefully I can answer more questions during the session. I think last time we had them only 60 minutes and we had a lot of requests to make them a little bit longer. And so this will go through May that you can see there. Okay. So this is a little bit about how it's going to go, and I realized right before the session started that I didn't get the timings. My math is a little bit off there. But basically, I want to talk a little bit overall about the idea of this step for a few minutes. I just have a few slides there. And then we'll spend about 30 minutes on each case study, and then we'll have a wrap-up. And then as Sarah was saying at the end, we'll have like a quick survey, some demographics from you. The slides will be made available to you through the link. You can see the PDF. And then for the next time when we have a webinar, we'll ask you to give us some feedback so that I can hopefully answer your questions about the next step there and a little bit more about the case study in there. So that's the overall idea behind this. So for the objectives, we want to talk about the differences between the systematic review and the scoping review. When we get into the case study, I'll get into the steps for each. We're going to spend most of our time focusing on conducting that reference interview and some of those first initial activities that you can do with your clients. Towards the end, I'll talk more about standards for reviews, protocols, and different potential outputs that you might talk with your patron about. So for the quick lecture, I got a few slides here. I'm going to define some types of reviews, think about that continuum, a little bit about the steps, and then some questions that you might consider during the reference interview, that initial time. And then also, what are those steps in determining which is the right review method? And that's kind of how this, the case studies will be structured, is around those steps and giving some specific examples of how I would work with a client. So trying to give you a little peek in my thought process there. So I kind of condensed the main types of reviews here, so you have one slide to refer to for that. I get a lot of questions from people when they hear my job title. Oh, what's a systematic review? What is that? So this is what I find myself explaining this quite often. I've done it in all different ways, and I've found that kind of what I have highlighted there in blue are some key things that really help people to distinguish them. So I like to start off by describing the narrative review as something that they've written many, many times. It's their old friend, right? Because anytime in a class they're asked to write a narrative review, here's a certain topic, you need to summarize that, it needs to be this long, this many resources, that kind of thing. For researchers, they've written this many times. It's just a lot of times it's a short thing that maybe 500 words that's going to introduce their primary study when they're trying to publish a report on that. I'll describe a scoping review as being, it's basically a framework of how to work through a certain set of literature where you've defined, okay, here's what I'm going to look at. And then you follow those steps. And some of those steps are in common with systematic reviews because they do need to describe their question and describe their search and that kind of thing. But there are some differences in there. And then lastly, I describe the systematic review as this is a research method. And that really helps them to think differently about the systematic review. And it's a research method that's answering its question by analyzing a group of studies. And so an easy way I like to say that is, it is a study of studies. And so hopefully that way of defining it, or some of those keywords in there, can help you when you're trying to describe this to someone. I really think about the different types of reviews as being on a continuum. And I've developed this idea in my mind over time, and then I finally kind of put it into a slide. So part of the pre-reading I gave you was the article by Goff, Thomas, and Oliver that he wrote a few years back, where he talked about what are the differences between the different review designs. And this kind of helped me think about this. So the narrative, very broad question, very subjective. Usually nobody describes their methods. And then we start getting into the mapping and scoping world, where people still have a broad question, but they're starting to describe their methods. Part of my distinguishing line between becoming a systematic review is that they appraise the study, and also that all the studies they're looking at are all trying to answer the same research question. That's one big difference between a systematic review and a scoping review. And then realist reviews I kind of put on the other side of appraise articles, because many times they do that in those types of reviews, but sometimes they're looking at different questions within the same realm. But we're not going to really focus too much on those. I just wanted to kind of throw that in there. So that's how I think about these. This is just one other way of looking at it. Scoping reviews can really vary in scope and how much you're going to look at as far as the search goes, but you really want to document that search. And you'll see throughout the search column it's always documented, but usually we don't have that in the narrative review. So several years ago I came up with this PIECES acronym. I was actually driving home from my grandmother's 97th birthday. When I thought of this, I had to pull over the car and write it down. And I remember my daughter saying, "Mommy, what are you doing?" Because we were pulled over on the side of the highway. So I liked this acronym. I had some other acronyms before this, but they didn't quite work for me. And the concept of the puzzle, I really liked that idea as well when I was thinking about reviews. So the P, the part that we're working on today, that's the planning stage. This is where you're framing your question, determining your criteria. This is your project management team, if you're lucky enough to have a team working on the review. And then the I is identify, and this is where most people think about the librarian. This is coming up with your search terms, what resources, determining how you're going to retrieve and document, getting rid of those duplicates. The E is evaluate, and this is where they've got to figure out what's relevant in here, what are we going to use, the sorting and appraising. The C is for collecting and coding, which we'll get to when we get to webinar number 4. We'll talk about how you could be involved in the coding and synthesizing. And it may just be that you're able to talk about the overall idea behind it and give them a few tools they could think about using. And then the E is, the second E is for explaining those findings, analyzing it, what do you need to do there. And then finally, the S is summarize, bringing it all together. And this is usually where the librarian comes back in to make sure that the search and the methods are reported properly so that they can get ready for publishing their results. So when somebody writes to you and they want to come and see you to do a systematic review, you start thinking through all the questions that you need to ask them. And so these are kind of some brief questions that start going through my mind. What's your overall topic? Why are you doing this? When is the deadline? You know, we get those people who call us and they're like, when is it due? Oh, in 2 weeks. And we realize that this is not going to be a systematic review. And what's their ultimate output? What are they hoping to do with this? Things that they've already collected, where did they put those? How much have they gone through? And how do you expect me, what role do you expect for me to play in that? And I do all different levels of consultation. Sometimes I know that I'm going to be an author, so I do a certain level of help for them. And then other times I'm mostly a consultant, so I'm just in and out. Maybe I meet with them twice and get them going on a project. And then there's a few more things I probably would want to know. I really encourage them to get their protocol registered, published somewhere. We're going to talk about that for a few minutes towards the end of our time together. Do they have a team? Who are they going to consult? That kind of thing. And then do they have any ideas about their software? To talk to them about some different options, different things to think about. And so I'll talk when we get to that part about what I do and what I suggest, at least for my clients. So when I go through the case studies, which we're about to start, case study 1 in the next slide, these are the 5 steps that I basically go through during that first meeting with the client. I am, first, when I first hear their question, I start thinking, does that question fit the systematic review? And then I start thinking about the scope of it. When they say it, oh, that's really big, or oh, that's too narrow, you start thinking through this process. And the other thing I want to know is, has somebody already done this? So I want to find any related reviews. I want to look at how well were they done. And then I need some estimate, like how much are we talking about here? And then kind of bringing that together and figuring out, okay, is this feasible to do? So let's, first, I need to make sure that I stop here at my key points for questions. Are there any questions about anything I've said so far before we get into the case study? Everybody's so quiet. So you can just type them into the chat box if you have anything. I'll give you a minute while you're thinking about that if you have anything, so that, oh, you like number 4. Do they really want 5,000? Yes. So for the estimate of the total number of citations, that's something that, we're going to play with their scope. And so I might say, okay, if you leave it this broad, that's about 5,000 citations. Do you have any other criteria? Maybe they hadn't thought about limiting by age, so we might talk about that. We might talk about settings or other things to think about. Let's see, do I always require an in-person? I prefer to talk to them at some point. It doesn't have to be in person. I do a lot of consultations online. I know that some services, they have a form that people fill out, and I have tried the form. I used it for several years. I've just kind of gotten it down to this pattern in meeting with people and getting what I need out of that talk. And my goal in my first few steps with few meetings with them is to get them to come up with their protocol. Oh, just got a lot of questions here. Let's see. When they say the process too long, they just want to do it in a few months. I can't help how long the process takes, and how long the process of a systematic review is going to take really depends on the number of citations that will be appropriate to go through for their topic, and also how long do they have to spend on it. So I have done a systematic review in 9 weeks. I don't suggest that to anybody. I had a very narrow scope and a very dedicated group of people working on it. So we basically did nothing but that for 2 weeks. But that can vary. So for the levels, if they just come to me and they say, I want to do this review and I need your suggestions, where should I search? And they're not doing a systematic review, or they're doing a scoping review, they really don't want my help, that's like one level. And I just kind of treat that as, I'm your librarian, you're asking for help, here you go. Other times, they want me to be much more involved, and then that's where I'm going to start talking with them about authorship. I plan on talking about authorship later as we go through those steps, because today's more about the scoping part of it. So we'll get into that some more. So let's get to some of these questions in a little bit. I want to make sure we have time to go through, but some of you have some really good questions. So we'll talk about the team and English only. Not sure what you mean when their question is, when their question would really be for systematic review is what he did. So we'll talk about that. So hopefully some of you have had a chance to read over this case study while I've been answering those questions. So what are some questions you might have in reading this? So you get this email, what do you start thinking? Yeah, so they just said they searched EBSCO. How far back in time did they go? And what do they mean they've collected 100? Like, what did they do there? What kind of sorting did they do? Yeah, I always discourage people. Sometimes they don't understand what ScienceDirect is, that it's a publisher. They think when they see that ScienceDirect that it's some somehow the scientific database, I think. Yeah. So these are some really good questions. I'd be curious, where did they put those 100? So if we start doing some searches, how are we going to sort them? And they're publishing, when is that, where is it, what are we going to do? So these, y'all have some really, y'all are thinking very much how I would start thinking. So when I saw this, I started thinking, okay, this is a faculty member. They already kind of know where they want this to go. I'm not sure what their timeline is. They've done some stuff. So how is that going to fit with what I'm going to suggest for them? And they had this really broad question, right? Just diabetes and depression, which I'm thinking, that sounds way too big. So what are you planning on doing with that? So I want to walk through those 5 steps of determining feasibility. And it's going to be a little different kind of webinar than I've ever tried before, because I'm trying to kind of give you a glimpse into how I think. So hopefully this, what I've come up with works in kind of showing you how I think through the process. So in that step 1, I'm really thinking about, okay, are they do they want to be able to call this a systematic review? How much are they going to be willing to change their question if they do want it to be a systematic review? And what is it that they're really trying to do here? Because they've just given me this really broad topic right now. So when I met with this person and we started talking through it, I realized that what they really wanted was a scoping review or a mapping review. I do differentiate between the two, but lately the things that I've been seeing coming out, they are kind of not differentiating between them, so I'm just leaving it at calling it a scoping review. And when you look at a scoping review, you kind of see those steps really fit nicely into what we do in a systematic review. It's just that when it comes to coding is when you're going to see the biggest difference between a systematic review and a scoping review. But also sometimes in the search, they're not trying to be comprehensive. They're trying to be more strategic or just selecting samples. So I've seen them done in different ways. So I got these steps from the Arksy and O'Malley article. This is the one that I usually give people if we figure out that they're going to do a scoping review, and that seems to really help them to understand. So it's kind of my go-to article for that. So we're going to work through this here. And some of these steps, it sounds like they're very linear, but they get kind of mixed up. So sometimes I keep going back to that initial, okay, if your question is that, then that's really going to be this kind of review. But if you alter it this way, then that's going to be that kind of review. So I put these in stepwise, but they can very much go back and forth in between them. These are just the things that you have to think about as you're doing it. So I'm really trying to, as I'm talking with this person, really trying to get a sense of what is their actual question and what's the eligibility criteria for that. So right now I just have depression and diabetes. And so I'm thinking, so who are these diabetic patients that you want to look at? Any age, any type of diabetes, and what aspect are you thinking about? Are these interventions? Are you looking at prevalence? What exactly are you trying to do? So when I ran a quick search, I saw that just with diabetes and depression in Medline, I was getting over 15,000 records. And so, I mean, I'm pretty sure he didn't want to go through all of those. And I was also thinking, you know, if they had already started selecting things, they might have some criteria that they're not telling me. So I'm really going to have to start asking different questions in different ways, showing them some different search combinations, and trying to get out from them, what are you trying to do? One way that can sometimes help in this process for me, especially if I'm working with faculty, is I say, oh, let's see, has somebody already done that? And so it's a way to look at to get that initial, let's put what the review you're trying to do into context by showing you some related reviews. And I think about, okay, I could look in databases that only have reviews in them. I could now with Prospero and other protocol databases, we can go see if somebody already done a protocol on that. Of course, I can always search Medline and look just for systematic reviews there, and then dissertations, thesis, that kind of thing. So when I started doing that with, I'll come back to the slide. I want to show you a little bit about what happened, and then I'll go back to those other slides in just a second. So when I started doing this, we started getting a lot of reviews back. And it kind of ran the gamut here between just the association between diabetes and depression. I saw symptoms, we saw use. Sometimes they were very specific about the type and the prevalence. So I was seeing several reviews that were already out there. And so I started talking with a patron about what is it that you're really interested in? Is there a certain population? What can we do about that? So when I'm looking for reviews in PubMed or Medline, I like to use some kind of filter to know, am I seeing everything? And there are a few filters out there. This is one of them that was published. It's been a little while, but they do have one that's for Ovid and one that's for PubMed. And then they differentiated. You can use one that's a little bit more specific than sensitive, one that's more sensitive than specific, and then one that's going to get you many more. So you have the option of how far you're willing to go to find reviews on that. So I really liked that aspect of it. So I use this quite a lot, copying and pasting and adding it into my search. And in talking with the patron about what we're trying to do here, this is kind of how I break down what I'm trying to do when I'm looking for the reviews. So I'm trying to see, do we find reviews that are about your exact question? So if it's the exact same question you're trying to ask, and it's been published in the last 5 years, maybe you want to do something that's slightly different than that. And so when I'm looking at those most recent 5 years, then I'm looking to see, did they do a good job? Did they cover everything? Maybe they only looked at Medline. Or maybe if they didn't do as well of a job, then maybe I'm going to do a better review than that. If it's been more than 5 years, there's been plenty of research out there then that you could do an updated review. But many times people would prefer to do something that's close but not the same. So then that's where I'm talking the client through different options of ways that we could limit this down. And I don't want to talk them into something they don't want to do, but at the same time, I want to help them to be realistic with their time. And then sometimes there's really no reviews out there on the topic. Maybe I was too limiting in the keywords I was putting in. That doesn't happen that often anymore. And maybe I haven't looked in the right places. So these reviews, once I find some related reviews to the topic, when we finally write the review, those related reviews need to be in the introduction. I want to compare my findings to their findings. I'm also going to look at their references. I'm going to look at, see how did they search for these topics, that kind of thing. So I saw the comment about the publication type. So I haven't gone and grabbed a new filter for this. Maybe there is a new filter that's including that one. But using that new publication type will probably only bring up the new one, so you'd still need something that was using the old headings as well. So definitely this is going to have to be updated over time. And it may already have been. I may not be using the most up-to-date one, so that's a good point. Oh, they can do it retroactive. That's great. So yeah, I learned from y'all too every time I do this. Okay. So I showed the patron this, and I started talking with them about, so which group, is there any age group? I was trying to get from them some other criteria. And in talking with them, we came up with they were very interested in adolescent. So when we put in diabetes, depression, and adolescent in review, we started seeing some reviews that had already been done on that. It was a much smaller set. We went down from our 15,000, so they were happy about that. And really, they wanted to really have an overview, so they didn't want to limit down their question to just interventions or just screening or anything. So they still wanted to stay kind of broad. But I was able to show how we could, we need to really define your criteria here. Okay. So then I started looking at some of these reviews more close up. So we started looking at places where they searched. When did they stop searching is another thing that I look at. So, this article, they stopped pulling articles in May 2015, and so a little less than 4 years ago, or 4 years ago. So there's definitely going to be some new stuff out there on this topic. They did a decent job in what they covered. At least they included PsycInfo. I see plenty of reviews done on depression where they don't actually search PsycInfo. So this is probably one that they might want to include in their scoping review, as scoping reviews can include things that aren't just studies. They might be reviews, they could be theoretical, they could be lots of different types of reports. And then we saw this one, and this was focused more on lifestyle interventions. And so we looked a little bit at this one and where do they look and things like that. And then we looked at a last one, and this was looking at quality of life. And that was something that interested them, was this aspect of it for the youth. And so we actually looked at this paper a little bit more closely to see what had they covered. And it came out in January of 2014. Don't know if I actually added a table for this one, but so there was plenty of new stuff on this topic for them to pull from. So this is where I was like, okay, let's pull some of those articles that are looking at adolescent quality of life, depression, and diabetes, and let's see if that's a direction that could help to limit down your review so you could get it done with your deadline. So then, as I'm talking with them, we're trying to get that criteria out of them, trying to see is this a way they want to go. So I want to do like a quick search, and then give them some of those results and have them start going through that process of really defining their criteria. I don't want to give them everything that first search gives us back, because when they're in this stage, they're really in discovery mode, and so I don't want them to have to repeat anything, but I do want them to start seeing the process, because it really helps them to solidify what I'm asking from them. So this is a really messy search. I didn't even really want to show y'all this. Oh, I forgot. One thing that we talked about was suicide. So we kind of went back and forth on that. We did talk about quality of life. And then in the end, we kind of decided, okay, let's look at just the ones that say depression, adolescent, and diabetes. And I think that's the 58 one there. So it's just kind of show you the messiness that kind of comes out of those conversations. And when I'm doing this search, I'm not trying to make sure, ooh, have I done the best search ever? Because of course for adolescent, I probably need several more terms in there. Maybe there's even a filter out there. But this is just that initial meeting with them, trying to figure out like what exactly are you trying to do before I go into full blown, okay, make sure like we do not miss one thing. kind of mode. So what I do from that is now I want to give them something. And so I want to download, say, the first 20-ish or so. So I like to use Rayon. So the next several slides are going to walk through the real specifics of how do I go from PubMed into Rayon, and then how do I explain how to use Rayon to my client. I'm going to show you some screens from Rayon in just a second, but basically Rayon is a tool for sorting citations. So to get these into that program, the easiest thing to do from PubMed is to use the XML. So here I selected, I think 20 or 50, somewhere in there, and then I just clicked Send to File, XML, and I like to rename the file once I have it with the name of the database, the vendor, the date, and the topic. And I'll show you why I do that in just a second when we get to this next screen. Oh, I don't even have the screen for Rayon. I'm sorry. I thought I put that in here. I might have taken out. I had way too many slides. So, and we're going to talk more about Rayon as we go through. So I just plugged into the chat box there, the Rayon link there. But basically, I just want to kind of show you what it can do, and then this can help you to think, do I want to use that? I just have a few slides on it here. So I create a new folder in here. So I just gave it a name. And then I'm going to upload my, my file. Because it's the very next thing once you create a folder is it asks you to upload some files. You can actually upload multiple files at the same time if you wanted. And from this screen, it shows you some different file types that you can upload. So it does show how to do it from PubMed XML. Most of the time I use RIS. If I'm doing Ovid or an EBSCO database, I like to use the RIS file, but in this case, it was PubMed. So once I have that uploaded, I get my screen that looks like this. So walk you through a little bit of this screen. So this shows that I uploaded 20 articles, and some of those articles were duplicates. Because when I look at my undecided, I really only have 16. So RefWorks has a lot of duplicates in it, and so it already took out 4. So maybe that answers Amanda's question there, the dedupe. Now, it is not great at deduping, and I don't use Rayon to do dedupe for me. So we'll talk about the duplicates as we go through. But this is just that initial, I want for them to be able to leave the meeting with something to start working on. And this is going to help them to start thinking through, what is my criteria? What does it take to sort these? Excuse me. So the next thing is I can think about how to customize this folder for them. So Rayon does this thing, they're called highlights, and you can see some of these highlights. The words that are listed under keywords for include are highlighted in green in the abstract, and words that are listed under keywords for exclude are red. Sometimes it's very confusing to the patron because they look at that where it says keywords for include, and they'll sometimes think that that has something to do with the keywords that I put into the search itself. I wish that they didn't call it keywords because that's confusing. I wish they just said highlights because that's what they are. So sometimes I'll go through and I'll explain, like, where did those words come from. You'll also see you'll see some words that I added by clicking on Add New. So there's diabetes, depression, adolescent. And then here's several words that I did not add in here. These are just the default part of what Rayon does. And Rayon was designed for people who are looking for randomized control trials, so a lot of them have to do with that. And then a lot of their words for excluding have to do with, oh, it's not a randomized control trial. So because this part of this project, it may be that they are looking at the prevalence of diabetes, of depression in adolescents with diabetes. I really want to remove that, so I just click on the little trash can there under keywords for exclude next to prevalence, and I could even then add that word into the keyword section. Really, these highlights are nothing more than helpers when they're trying to sort things, and by doing this little bit of customization, makes them feel like, oh, this is for me, this is going to help me on my project. So there's also some of that feel-good kind of stuff in there when you do this. You can also search by clicking on any of those keyword tags over there, and you'll see the numbers. These numbers are so big because when I first did this, I did put in all 1,400, and then I realized for this example, I just wanted to do 20. So I just hadn't updated those numbers there, so that's why they look so big. Really, this should be much smaller numbers over here. So you see under diabetes, it says 1,285. There aren't that many records in here right now. So sorry about that. Anyway, so do you have any questions about Rayon? We'll talk about the deduping. Anything else before I go off the screen? Okay, so what does Rayon do? Okay, so I just uploaded 20 articles from PubMed. You could upload, I have one of my folders has 18,000 records in it. I could upload multiple citations. I could upload many different files in here. But basically, this is a citation sorting tool. It's completely free. I don't think that it's open source, but it's free. You can have multiple folders in here. I have one account that has over 300 folders, reviews running in it. So it can handle quite a lot. I can invite different groups of people to each folder, so it's kind of like Google in that way. And then I use one folder for one study. And so I can type in Rayon again. So it has 2 Y's and 2 A's. Right, so you're sorting, oh, I'm sorry, I should have said that from the start. So yes, so what they would do is they would click on a title, and then they would see the abstract and anything else. So in this case, this particular article that I have highlighted here did not have an abstract, but many of them will. And then they would click include, exclude. If they label it as a reason, they can do that. There are some defaulted reasons. So there's one that says wrong population, wrong study type, different things like that. They can actually enter their own reasons as well. So it's a way of sorting these, keeping track of how many for that reason. They can also have multiple people sorting these together where they don't know what the other person has marked because you have the blinding or masking turned on, and then you turn that off and they see which ones didn't they agree on. So it really helps with the selection process when they need to have independent screening going on. So I haven't had a, so one person was saying that they were having issues when uploading the XML file. It has worked well for me. I've had more problems with RAS files than I had XML, but I also don't do XML a lot because I'm not a PubMed searcher. In this case, we were using PubMed, so I moved over just those 20 for them. So I don't know that I could answer that. The other formatting types, I can definitely talk about that. So the one that I use the most often is RAS. Yes, it's, is it really 100%? Yeah, it's really free. I've been using it, I want to say close to 2 years now. I'd have to go back and look at the date where I started. But I have one account that has 300 reviews running in it right now. And one of those reviews has over 18,000 records. I have another folder in there that has probably 450 PDFs uploaded in it, and that's just one of the many in there. So I don't know, it depends on what you mean, could it be used in place of EndNote? So you're probably still going to want a citation management tool at some point. And when you are done sorting these, you can export back into an RAS file, a BibTeX file, or just plain old spreadsheet. So you're probably going to still want to use some type of citation tool. I don't like to use EndNote for the sorting part. I know many people do, and I haven't used EndNote enough to do that. Also, I work with a lot of teams that aren't based here. And so because this is free and it's so easily used by many people, we're able to get a lot of people working on it very quickly. It also doesn't take a lot to explain to the researcher how to do this. It's very intuitive. It doesn't have a lot of bells and whistles. So I found the learning curve to be pretty short. I can usually show them everything it can do in about 5 minutes, and then they're out the door. I do have a little handout. I'll be happy to share that with y'all before the next time. It doesn't have a lot on it. I think it's only 1 page long. And I have used RefWorks for the sorting. RefWorks hasn't been great at the sorting process. And I mean, I used RefWorks for a long time completely for sorting, but there are some things that it didn't do great. When I was trying to sort, they couldn't see the results of the sorting right away. I was hoping when they came out with the new version that the tags would help with that. It's been a while though since I tried. Once I found Rayon and it worked great, I was like, I'm just going to stick with that. But I do go back to RefWorks. So after we've determined what we're going to include, I do export back into RefWorks. So how are, okay, so the keywords. So Rayon has its own set of keywords that are the default. So those keywords basically are all around randomized controlled trial idea. So you see trial, randomized, randomly, that kind of thing. They also have some preset exclude words, and these tend to be things that show that it's not a randomized controlled trial, but they also have things like mice, rats, animals, that kind of thing. And I also do veterinary searches, so sometimes I do want it to say animal. You can customize those highlights to be whatever is helpful for you. We're going to go a lot more into Rayon when we get to step 3 about evaluating. So I want to make sure we have time to get to the other case study, which is actually a systematic review. But I just kind of wanted to introduce this, and we're going to talk about dividing into teams. How do you make sure that what everybody is assigned? So we'll go into some more details there as well. And I'll talk about a few other tools. This is the one that's really fast for me to get them out the door and going with, so that I can get some feedback later. Once I set this up for them, I do explain to them the process, that this is just a few articles for them to get the process going, for them to start working out their criteria, that they're just looking at the abstracts here. So when you're looking at titles and abstracts, you're looking for reasons to kick something out. You're not looking for reasons to keep it. So if I can tell, oh, this article is about adults and I want adolescents, I'm going to kick it out. If I can't tell what the age group is, I'm going to keep it in. And with scoping reviews, you can be much more inclusive. So you can include lots of different things, but you want to establish those boundaries. And that can be sometimes a hard thing when the person has been just kind of out there collecting. Now we're trying to help them come up with that criteria so they can be more selective when they're doing this. One option is once I have that folder established, I can invite others to it. I just add in their emails. I put commas in between. and then they're invited to the folder. The one thing that I can do as controller of the folder is I control the blinding. So sometimes it's helpful for them to create the folder so that they can control that, so they're not writing me at 8 o'clock at night saying, can you please unblind something? Unfortunately, I haven't learned my lesson. I keep creating the folders for them, and I keep getting those things. So it's just something to think about. It's quick and easy for them to set up their own account if it's not going this way. And sometimes I ask them to create it before they come and see me if you plan on doing this. So as we're going through this webinar series, I'll talk about different aspects of Rayon and different issues I've run into. So in the end of this, we've got to figure out, okay, is this going to be feasible? Can they make their schedule? So some of the main issues I had with this project is I just said, you know, your scope was really too broad. You need to finalize your question, really think about what are you trying to do here. They wanted to get this article out in 3 months, and so I talked to them about managing their time, and, you know, we were really going to have to do that quick. We were going to have to narrow it down quickly so they could move on to the other steps. I expressed my worry that 3 months was not long enough. And so we've talked about that with the faculty member. And I just said, you know, if you keep changing your scope, that's going to change where I suggest you search in the keywords, because that was something that we had during our conversation with the student. Well, I liked that they liked the suicide part, or they liked that this, and not liked, but that was one direction they were thinking about going. And so we had to keep talking through that process of you don't want this to become this huge amoeba. You're not going to be able to finish if you keep doing that. So, and I've talked to that. I gave them an example of a scoping review that was related to their topic. I gave them a short handout on Rayon, and I also suggested that they read one of those first articles that I put into the pre-reading on here, the Arksy and O'Malley, as a helper for them. And then I gave them suggestions what they needed to do for the next time. I asked them to look over those related reviews that we talked about. That's probably something they're going to want to talk about in their introduction of their scoping review. They really needed to finalize that research question and give me that list of what is your eligibility criteria. I said, I can't build a great search if I don't know what we're looking for. And anything they'd already found that matched their final eligibility criteria. So I didn't want to see all 100, but they needed to really narrow that down and then show me anything that they had already collected that matched that. And then I talked to them about, we really want to develop your whole protocol. We want to think about, okay, once you find this stuff, what are you going to do with that? And that's what we're going to be talking about during this whole webinar series, is how to help somebody develop that protocol. And the role that you can play in that, different tools that can help with that. And so this is what we did. Okay, so I'm going to put up the case study too, but I wanted to see if you have any questions at this point about that case study before we look at this next one. I can also open it up and say, what questions do you have when you see this email? That might be a better way to get some response from y'all. Sure, so timeline is a big thing. Yeah, so I get that a lot, all of it. Yeah, so, you know, in a lot of these emails, you'll get like kind of these blanket statements, and you're just wondering, you know, what are they thinking about? Um, yeah, so physical activity was one that I was very curious, like, what types were they thinking about there? Um, and I also thought that the list of places to look was interesting. Um, yeah, so so when I was thinking about this, I started thinking, okay, what do I know? Um, so one thing I know when I'm working with a graduate student and they say they're working on a project with a professor is that there's going to be key points where I need the professor's buy-in to what we're doing or to make sure that that's the direction to go. Because I would hate for that graduate student to, you know, do a lot of work and then the professor's like, oh, I don't like that. And that's what some of these conversations becomes difficult because they can't make like that final decision. But I get a lot of projects where this is how we're starting off, is without the professor in the room and we're trying to figure out what are we going to do here. Um, and um, and so I'm really going to need to know more about what is the goal, what are they trying to do. I know I'm going to have some work to do on convincing the professor that, you know, like some of their choices of database may not be as helpful, and then there's a whole other list that they might want to think about. So these are things that are starting to go through my mind as I'm working with them. And so when they say the correlation here, I'm wondering, okay, well, so what are you looking at there? Are you looking at prevalence of both of those within diabetics? What exactly are you looking for? So I'm going to have to start pulling from them exactly what are we trying to do, so I can better decide, is this going to be a systematic review or is this going to be a scoping review, depending on the direction they want to go. And so it turned out that they really want to do a systematic review, so they were willing to change the question and frame it as they needed to make this a systematic review. And so then I start talking to them about we want to make sure that we're following appropriate standards. We're trying to minimize bias here. Here's some things that we need to follow, and start talking through the steps with them, just to make sure they understand how this is going to be different from a narrative review, which is what they were already, you know, super familiar with. And when thinking about a systematic review, you know, a lot of the guidance that we get from Cochrane and other places, they seem to all be aimed at effectiveness questions. But there's a lot of different types of questions that we can answer with systematic reviews. And in this case, this might kind of fall into the risk or protective category. So it could be that for those diabetics that are doing physical activity, that their prevalence of depression goes down or something like that, or could be helpful in other ways. So just it's going to depend on which aspect they're trying to do, but there's all these different questions that you could answer with the systematic review. So this is just another graphic that I'll use with people to help them to see other types of reviews and other ways of thinking about what are we trying to do here, to help them to think about their method and what we're trying to answer. So as I talked with them, they kept giving me that correlation one. So I was like, okay, so we have diabetes, the exposure, or might say the risk factor, you might describe that in different ways, is physical activity, and then they were looking at the outcome of depression. Now, if you look at how Cochrane says to design your search, And what I would always say is, oh, don't include outcomes in your search. But in this case, we really were we really needed articles that were talking about all three. So I did put depression in my search. So you're going to see that. Let's see, we have a question here. Can you explain the difference between mapping versus scoping? So for the most part, a lot of the things that I see are not differentiating between mapping and scoping. They're treating those as being exactly the same. So I would say don't worry about that too much. But I was fortunate enough to see Dr. Andrew Booth and take a few of his classes. And he described it in this way. A mapping review is where you already know where the edges of the map are, and you are trying to show the landscape of what's there. In a scoping review, you haven't figured out your scope yet. So you haven't figured out where the boundary is. You're trying to figure it out. I would say that most of the things that you read that are scoping reviews are really mapping reviews, because we really, it's messy. So there's not like a great answer. And that's why I say, like, I usually don't really differentiate there. I didn't use PICO for this because we weren't looking at intervention studies. What they really wanted was just cross-sectional and longitudinal studies. So this isn't an effectiveness question. So that's, you could have done it as a PICO, I guess, but to me, there was no, there isn't going to be an intervention, really. So we're not going to be looking at, okay, if I have this group of people undergo physical activity, and then I'm going to be comparing depression between the two groups, maybe a group that didn't or did it in a different way or something, I don't know. We weren't going to be looking at those kinds, so hopefully that helps. So as I talked to them more, we started getting that what they really wanted to look at it was how were studies measuring physical activity and measuring depression when they were trying to do this. And here they weren't just looking for people that had depression as a clinical diagnosis, but just depressive symptoms or feelings. And then they really wanted the cross-sectional and longitudinal studies, so we didn't look at any interventions. So I just keep talking through them, trying to figure out what are we looking for here. They only wanted adults in this, and they said that's 18 plus. So starting to get some more criteria for them as we went through. So when I decided to start looking for relevant reviews, of course, I did look in Medline for relevant systematic reviews on their topic. I also thought, oh, I need to look in Prospero and see if there are any protocols out there on this topic. So I went into Prospero. I put in just diabetes and depression there, so I started seeing a few things come up. And one of them had to do with physical activity, so we started looking through there to see is anybody planning on doing this. So that's something to think about as Prospero keeps growing. And then I also went through, and these are some abstracts of articles that I found that are already out there. So one thing that I do is I'll look through a few articles with them, a few review articles when they're sitting in my office. I kind of scroll through it, see what's going on there, and then I'm going to show you what I asked them to do with those articles for the next time as well. So we'll just look at it. I just have 3 here, so we can talk through a little bit about what I look for and then what I ask them to bring me back. So I look at their overall questions. So here it's talking about they wanted to look at the association between diabetes and depressed mood. So that's not just like clinical depression, but depressive feelings, that kind of thing. And this one also wanted to include interventions. So that was something that we were not going to look at, so it made our review a little bit different. I looked at the years that were covered by this one, and you can see that they stopped collecting in 2007. And then they searched Medline, PsycInfo, spelled wrongly, and Embase. So I said, okay, they covered 3 databases. That looks pretty good, but it's an older one, so definitely we don't have to worry about this one. We looked at this one, and this was talking about adherence to lifestyle changes. So that's slightly different from what we were looking at. And here they stopped collecting in 2012. I can't tell from the abstract where they searched, so probably going to want to know something about that. And I'm always trying to mine these related reviews too for any ideas of places I hadn't thought of to search or keywords I hadn't thought of, things like that. So that's another thing that I'm looking for in here. And then this last one is, this one is also looking at the interventions. This one also looked in ClinicalTrials.gov, so that's good. And they were only looking at randomized control trials, and they have like a time period here. So this one was definitely looking at this from an effectiveness point of view. Okay. So what I ask the client to do for the next time is to ask them to put together a little table. And this is going to help me, and it's also going to help them. Because I want to see something about, okay, what's their overall question? What was the time period that they searched? So we can know something about the recency of that. And then sometimes, they'll put in, okay, how many studies did they find, things like that. And sometimes, I'll give them, okay, here's 30 reviews we found in a quick search on your topic. Pick the 5 most relevant ones and do a table like this. So this does 2 things. First, we need to know, has this already been done? And so they're going to need to look these over. Second, it gives them an activity to do that's pushing their review forward. I tell them you don't have to read these reviews from beginning to end. Here's some essential information we need to start getting from there. But the other thing is that it's going to have them read some systematic reviews and start getting an idea of what's required of them. And when they come back and we talk about those reviews, I can also talk about what those reviews did great and what they didn't. So they start seeing, oh, there's standards to doing this. And we can talk about what we're going to do better. So it just kind of gets them involved in thinking through this process. I think I need to start talking faster. I got a bunch more slides. Or maybe I'm not doing so bad. It came out that they wanted those cross-sectional studies, so I ended up doing a search with diabetes, physical activity, depression, and then trying to limit down to cross-sectional or longitudinal studies. And so I moved these over into Rayon. And in this case, I had an RAS file. And then I showed them how to, I talked them through the process there. I was very worried that cross-sectional was a harder one to limit to than randomized control trial. I did use a filter that I had found, but I wasn't sure if it was great. And then also physical activity. I said, I think we need a few more keywords there. And we needed them to better define it. So those were some things I asked them to think about when they were sorting. So this group, they had a year. I said, that's great. That's a good amount of time. They had a team of 4 to 5. They weren't sure how many people were going to be involved quite yet. They did have a subject expert that was going to be, the professor that was going to be working with them. And then they had me. I thought we had plenty of data. And then I started talking with them, okay, if we're going to do a systematic review, let's focus on your protocol. Let's get that registered. We need to think about how we're going to manage your data, manage the team, think about software, what we're going to work with. So those are some of the main issues I wanted to work on with them. So I asked them to think about some of the outputs that they can do. And really with the systematic review, you can have 4 main types of output to think about. So you can register your protocol, which is a publication that you can add that to your CV. There's different places that you can put a protocol. We'll talk about a few of those in just a second. Prospero is the one that I think about the most, but there's a few other places. You can publish your preliminary results at a conference as a poster or presentation. And of course, you get the thing they're most thinking about is that peer-reviewed article. I always encourage them to think about an open access place and how can we get some monies for that. And then I say once you get that published, think about a place where you can reach the public. So I encourage them to publish something in the conversation. I'm trying to get the last 2 groups I just worked with. We're working on writing up something to go in there. I say, but you can also do a 5-minute video, some other things. So there's ways we can start getting the word out. Oh yes, predatory journals. That's something I'm trying to work into my service as well. I just did a workshop at SCC on that. That was really good. Opened my eyes. So when we get to the last session, we're going to be talking about authorship and selecting journals, things like that. But those topics I talk about here in the beginning as well. So it's something that we are going through throughout the process, is trying to figure out, okay, where are we going to do this? Where are we going to put this? So, so when I'm thinking about a project, and I start thinking about, okay, which standard should we use? Where are we going to publish this protocol? I work with people outside of clinical medicine a lot, so I do a lot of public health, policy, also do veterinary and agriculture and engineering and lots of things. So there's all these different organizations. This is just a small list of different organizations that I can think about. If you haven't heard or gone and looked at Campbell recently, Campbell is starting to expand the types of reviews that they are looking at. They also have a nutrition subgroup now. So this is a place where you could look for standards, look for funding, and registering a protocol as well. So I just put that out there. For this one, we decided that we were going to mostly use Cochrane's standards and that we were going to publish our protocol in Prospero. Different places you could think about registering your protocol. Prospero is the one I think a lot of us hopefully have heard of. It's a free place to register your protocol. They do not take scoping reviews. Several of the other ones on here do take scoping reviews, and they only will accept something if it has a health-related outcome. So your review can be a health topic, but if you're just looking at methods as your focus, I think they don't want those types. So they're not like super picky, but they are a little bit. But I've had really good luck getting protocols published there. If you're doing anything with agriculture, animal safety, health, welfare, the second one on the list, I'm not exactly sure how to say it. That's the SYREAF. They're accepting protocols, different types. JBI publishes protocols with scoping reviews. And then JBI, the open, I've also seen several types in there. So there is a timing thing to think about the protocol. You don't want to have finished your review and then register your protocol, but you probably don't want to do it when you haven't done at least some of the work and figured out when you're going to do this. So I think that there's some timing issues in there. And I've also worked on projects where we never got further than the protocol. But the protocol is the first big win with your team. It encourages them to keep going. And so that's why I like to encourage them to do that. So they get to have something put on their CV. And most of the people that I've worked with where we have registered our protocol actually go through to the end. So I'm not sure if it works out great. This is just a little bit about what Prospero is looking for. I think I've kind of already said this. So here you see it says reviews of methodological issues, that's a long word, need to contain at least one outcome of direct patient or clinical relevance. So a lot of my own work that I do is more on method issues, so I wouldn't register that protocol in here. I would need to use another outlet. There is a document that I will print out and hand to my patrons. And so I did put the link on here. You'll be able to see that later as well. I think I'm going to go just a little bit faster here, a few more slides. In thinking about the types of software, the SR Toolbox is my favorite place to go. That's how I found out about Rayon. I'm trying out a few other things that I found in there. I love the Twitter feed because it tells me like the new thing, what people are talking about. These are all the different types of software they may need to think about. I do encourage them to learn some type of citation management. We support, we have RefWorks and EndNote here, and we also have a big group that uses Zotero. I still have a few people talking about Mendeley, and then sometimes they'll mention something else completely. The nice thing about Rayon is that I can export that file into something that other program can understand. So for me, it doesn't matter which one they do, as long as they have something. So I hand them the Prospero handout because they really wanted to do that. I give them some example protocols, especially as related to their topic. So I gave them a few on diabetes to look at. Something to know is that Prisma has been working on one that's just for standard, just for scoping reviews. But in this case, this was a systematic review, so I wanted to show them what was going to be expected at the end. So just kind of preparing them for what's coming next. I asked them to look over those related reviews, fill in a little table, really finalize their question and those eligibility issues. If they had any other articles, show me that, and come with any questions they have about submitting the protocol. So we're going to keep talking about that. So every time a client leaves me, I try and give them some action items of schedule an appointment with me when you have done these things. Because I try to avoid them just coming and seeing me once a week and then they haven't really done anything. So I'd like to give them some things to think about and to work on. So that's the 2 case studies. We have about 10 more minutes left for questions. I put up here my 3 favorite books on systematic reviews. I look at the Booth one often and point students there, especially if they have, if they're working on a qualitative review. That's one. I haven't done a lot of work with qualitative primary studies, and I always feel a little unsure of what to suggest they do. So he has done a lot of work, especially with qualitative, but his book does cover both, and so I find that to be really useful.
All right, Margaret, I think we had a couple of questions go by earlier that were not yet addressed, so I'll go ahead and read some of them. People can keep entering them in the chat box.
Thank you.
One about publishing the protocol. Someone wanted to know if you had any thoughts about OSF, the Open Science Framework.
So I think if it was really a clinical question, I'd really encourage them to do it in Prospero because that's kind of a known free one. But if it doesn't make sense to do there, you know, get it out there somewhere. I haven't looked a lot at it. I looked at the ones that I put on there, and it's one that I want to look at next and see kind of what's going on with that. but I would just encourage them to get it somewhere. So, but I haven't had a chance to look at it, so I couldn't talk specifically about it.
No worries. Thank you. I think also very early on in the session there was someone wanting to know more information about who ideally do you have on a team when you put that together for a systematic review.
Oh, okay. So, I mean, an ideal team would be you need somebody who's a subject expert. You need that at least as a consultant because I need to know the context of it, of the topic. If you're going to do anything with statistics, we're going to need a stats person. You have a methods person, so the methods being the systematic review process. And sometimes that, in my case, that's the librarian, me as well. And then you have your search specialist. So some of these people you may be just consulting, but ideally that would be like the perfect team would be having all those people together publishing something. So.
Great, thank you. I think another question was, do you always make people who've contacted you come in for an in-person interview, and what are the reasons for having in-person versus just online communication?
So I don't want it to just be an email, if that's what they're trying to say. If they can't, and we have a very dispersed campus. We have people that are very far away. So I do a lot of online meetings because I need to ask them some questions that are more open-ended. I need them to see, okay, so if you do it this way, this is what we're seeing. So really, it's just faster is the main thing. If they just say, hey, I want to do a systematic review on this, you know, I could spin my wheels and do a lot of work, and then I'm completely off. So it's more about being effective than anything else.
Right, right. Let's see, I don't see a whole lot of new questions. I do think, I know you've mentioned, Margaret, that recently in the literature, scoping reviews and mapping reviews are kind of being used interchangeably. If you were to define the difference between them, what would be the difference between those two?
So I think I kind of said this before, but I know it's a hard thing. The main thing I would say is right now, what we're seeing, people are not differentiating, but most of the things that you're seeing called scoping reviews are really mapping reviews. And then some of the things I see that call themselves scoping review, it's really a systematic review. But I think they were worried if they called it that, they would be held to some higher standards, so they just called it a scoping review. So I've seen all different things, but really a scoping review is where you're trying to figure out what should my scope be, and a mapping review is where you already know what you want the scope, but you're just going to tell people, okay, this is what I found. And that's why a lot of what you see out there that's called a scoping review is really a mapping review. When I got to see Dr. Booth, he said, really, why are we publishing scoping reviews kind of a thing? Because that's really the preliminary work that you're doing when you're trying to figure out a systematic review. But, I mean, so it's a fine line. There's not, I think, an easy way to say that.
Right. And do you find that those different terms are used differently across different disciplines? Because I know you work with several different disciplines at A&M. And
I think it differs in the disciplines, but it can even differ between different journals even. It's a little bit Wild West right now. I think for systematic reviews, we have really set standards, not just in medicine, but with the Campbell collaboration and other groups like that are setting standards for social sciences. So we're starting to see, like, this is what this means kind of thing. Scoping reviews has been a little bit iffy. Integrative reviews is another hot topic right now that really hasn't solidified into any kind of standards. For realist reviews, there are standards. Now there's really something to follow. So I think it's going to take a little time for things to settle when it comes to scoping reviews. The Joanna Briggs Institute, they have their guidelines for what they call a scoping review. So you do have some standards that but it's still a little Wild West. So.
Great, and I think we'll do one more question before we move on to final housekeeping, and I think this is a really fabulous question, both for systematic reviews and maybe other huge tasks as well. How do you keep track of your own documentation for what you've done for each client, especially since there might be time lags between the initial and the follow-up appointment?
That is a great question. I can tell you that I do a really, really bad job of it. Let me just start with that. So just to give you an idea of my volume, I recently had to turn in my annual report, and last year I did 500 consultations. So they are going back to back. It's like a constant thing, and I do a lot of answering questions by email. So I do not do a very good job of tracking what I've done for each client. I mostly just keep track of how many things have I done and for which group of people have I done that thing. So right now I'm just tracking where are they coming from, is this a consultation, an email, phone call, but nothing else really. There are certain projects where like I'm on a grant for them, so I do have to keep better track of that. But it's mostly just for those projects. Otherwise, I'm not doing a great job. I think the next big thing in running systematic review services is what should we be keeping track of? And I know some services, they charge for their services, so they do a better job of tracking that because they need it for reporting. But I don't have a great answer for you. I usually have to ask them when they come in my office, as I say, okay, what was your topic? What did we do last time? Sometimes I'll go back and look at the emails that we had back and forth recently. I sometimes kind of wish I had like a nurse or something to give me a chart and say, this is where we are. Maybe that's what I should start doing, is charting all of this, but I don't.
Okay. Well, thank you so much, Margaret. I want to extend, of course, another huge thank you for this first wonderful session. I hope everyone will join us for the future sessions, but I'll go ahead and let Margaret log off before we do some final housekeeping. Thank you, Margaret.
Well, thank you, and just I put up the dates for the next ones coming up, and I look forward to going through this and answering your questions. So thank you for coming.
Wonderful. I'll go ahead and stop the recording now, and then we'll move into some of our final housekeeping items.